Welcome, and thank you for tuning in to On the Go with CAO, a podcast by the Centers for Advanced Orthopaedics. Join us as our orthopedic specialists share their tips and advice for keeping you on the go and in the know, including the latest on how we're treating and caring for injuries and diseases of the body's bones, muscles, joints, ligaments, and tendons. We're here with over 60 offices in Virginia, Maryland, and DC to keep you active and on the go.
Welcome back to another episode of On the Go with CAO. We're here with our physical therapy panel again. Today we're going to be discussing considerations for total joint replacement, specifically the idea of prehab as well as rehab. And I did not misspeak. Prehab, I know, fancy. We're talking about the idea of doing rehab before and after a joint replacement. Why don't we kick it off by just talking about what prehab entails? Is that process any different than the physical therapy that you would get after a joint replacement?
So the process is the same. You're still going to come in and have an evaluation. They're going to take measurements, evaluate every part that they would for any other condition. The difference is that they're also going to talk about considerations for your joint replacement and educate you on things to take note of or be aware of to prepare you for what to expect afterwards.
There's a lot of stuff that goes into that, right? Like you got to think about the aftermath before you actually get back to PT, right? Whether it's home PT, inpatient PT, I mean, you've got to get out of the hospital and you got to get back to your home after the surgery. And so whether it be durable medical equipment, whether it be how to use those things, right? Like I don't know about you, but the first time I hurt my foot, I didn't know how to use crutches. Someone had to show me how to do that. And so there's that time period where getting a physical therapist and meeting with one early on, right before your surgery, could set you up for success very, very quickly. It's not something that a lot of places do.
One other thing I've noticed is when the therapists have time to talk to the patient. And so one thing that we can do in prehab is we can talk to the patient, tell them what to expect, help them understand what's going to happen during the surgery and after the surgery. And we also help set them up for the best outcomes before the surgery. So the total knee replacement that goes in with restricted mobility will have more difficulty coming out. So we look at the things that we see and we identify as issues that need to be addressed going into surgery. The better the range going in, the better the range coming out. If patients know how to engage their quads and prepare their muscles for post-op rehab, then they are more confident going into surgery and they're more likely to have better outcomes.
Take us through that first visit. What are some of the hallmarks? Elissa, you just touched on some. What should the viewer expect if someone is getting set up for a total joint replacement or a spine procedure? What's that prehab visit like, and what should they really expect between that and their actual surgery date?
Well, I think the first thing we do is we do take measurements because we want to see where are they, what's going on. We look at flexibility and range of motion and strength. Things that we know going in are really important for coming out of surgery. Another thing, especially if we're talking about joint replacements, is looking at proprioception, which is your balance and how much can you control your balance as you're about to have a prosthesis put into your joint. What is your self-awareness of where you are? So we look at the things including balance and strength and flexibility, and we give you some ideas of what to do going into surgery. And then we also have the opportunity to talk to you about coming out of surgery.
There's so much education in those prehab sessions. There's so much talk about, what to expect from a timeline perspective. How long until I'm well? How long until I can drive? How long am I going to be on crutches? There's a lot of talk about just general timelines. There's a lot of talk about signs of infection, signs of blood clots, just general red flags to be monitoring after surgery, wound care, things like that, again, they touch on it in the physician's appointment, but we get a lot more time to go over it in detail. And prehab isn't always one session. Sometimes you get several sessions. So A, if they have more questions, they can continue to have them answered, but B, if they actually need work on things, if their flexibility was poor, or their motion was poor, we can spend several sessions working on it and improving it before surgery.
How many times do we get patients who come in the door and don't realize that something as simple as getting onto a toilet seat or transferring from their car to into their home, or from their bed onto the chair and the recliner, like after having a hip replacement or knee replacement, there are precautions that they have to worry about, certain positions they have to avoid. I mean, the number of times we get patients who come in and they don't realize that first shower, like how relaxing and how great it is. And a lot of times it's us giving them the direction of how to protect their wound, how to move in a certain way, how to teach their family how to help them move, right? Because a lot of times that's another thing too, getting that, that partner, that significant other, whoever that is, that mother, brother, sister who's going to help you move and kind of get them going along, and having that family education component too. And that's something that we get, like you said, the chance to do. You both said it beautifully, because we have the time to do it, and these prehab appointments do that for us. Whereas a lot of other places, a lot of other spots that you're in, you don't have the time to do that.
One of the biggest challenges for us is that we do this all day, and it's very easy to lose our perspective on what it's like to be a patient, and to remember that surgery is terrifying, right? And most of these patients have never had it before. We live in this world. We know what to expect. It becomes routine. And so the idea, at least we tell our team, treat every patient as though they're a family member and see it from their eyes, from their lens. Prehab clinical implications aside, rehab outcomes aside, just having a chance to spend an hour one-on-one and listen to what people are afraid of. What are their concerns? Give them a reasonable expectation of what the surgery and recovery process is going to be like. And I really think just even emotionally, that's going to help their outcomes going into surgery and then immediately afterwards.
Plus, to try to get any of that information at the first visit after surgery is so much more difficult. They're hurting, they haven't slept, they can't move, they're having trouble. So it's so much easier to get that information ahead of time, so that when they have that first post-op visit, it's not new information. You already know this patient, you already know what they looked like before, and you really can just hit the ground running.
There's a lot of pearls of wisdom that I think the therapists drop, that because we do this all the time, we've learned along the way.
We've seen it all.
Little suggestions that we just take for granted. We see a lot of total shoulder replacements now, and telling them coming in, you might want to wear your husband's button-down shirt the first day or two, because it's so hard to move around. Or, for that knee replacement, to pick up the little rugs in their house so they don't have tripping hazards, things like that we can share. I think when patients go in with more confidence and comfort, they just feel a lot better. So the first couple of days coming out are much more comfortable for them.
It is all those little things.
Yeah.
I mean, upper extremity patients, the first time they try to brush their teeth with their non-dominant hand, it's like they lose an eye. And these are the things you don't think about, but we can at least prep them ahead of time so it's an easier transition. As I'm sure most of you are aware, our CAO doctors are definitely on the forefront of cutting-edge surgical technology and surgical approaches. The timeline for rehab has changed a lot, and I think that's driven a lot of this prehab process. Many doctors are now, for healthy patients who have a good support system, they're actually doing these surgeries at outpatient centers, and people are home the same day. And so for physical therapists, that's really changed our approach. I'm curious to get some feedback from the panel here. How have your therapists have to adapt to seeing a patient post-op day 1 or 2 as opposed to week 4 or 5?
That's a tough thing to have. We actually had a lot of discussion amongst our therapists, because some had prior experience of working at other locations or other facilities where they actually had to have patients come in. But like you said, most of us are comfortable with the 2 weeks out, 3 weeks out after surgery, and they've had some of that. Some of us, including myself, we've had major surgeries, and so having major knee surgeries or hip surgeries, like, we have had those conversations with our staff, and now we're working hand in hand with our physician staff, and there's a number of physicians who know, like, okay, yeah, Sami will see you day 1 after surgery, and at the 14-day mark, he will communicate with me and my staff, and we will have your stitches removed or staples removed, and we will handle the wound care, and we will get you moving in the way you want to. And I think it's made us utilize our skill optimally, but it also has humanized us, because I think a lot of us are now on the front line with those patients, right? I'm there 2 to 3 days a week for an hour with that patient, talking about all these things, seeing their progression, seeing how those effects of some of the medications and stuff like that they're having, and talking them through it, and then also collaborating with the other staff and the physicians. And so I think it's changed the world of rehab a little bit in a positive way, because we truly have become, this worldly 360 type of approach.
Yeah, I love the humanity aspect that you brought up, right? And so what's one of the biggest knocks on the modern healthcare system is that it's lost that humanity piece, partially from technology, right? Everybody's staring at their device instead of looking at their patient because of how many clicks we have to go through. And then just the time piece, which we've touched on. I think physical therapy does humanize a lot of this recovery. And it brings it down to that micro level of, okay, how do you live your life in your home with your family? And that's really what people want to get back to.
Getting into the outpatient orthopedic clinics faster, I think, has been great for the patients. I think we have equipment, we have the support, we have, a lot of places have parallel bars, we have the mirrors, we have stationary bikes, we have a lot of support around us, and so we can help them get up. They're not trying to stand on their own after having a knee replacement right away with all the pain. And so the quicker they get into outpatient rehab, I think the better their, coming out of the gate is, that beginning first stage of rehab.
Let's talk a little bit about that post-operative side now, the typical rehab course. What kind of outcomes are you all seeing from some of these total joint replacements? I mean, that technology itself has changed a lot in recent years. Things like total shoulder replacements, some of the spine surgeries that we see, total knees, total hips. I mean, what can a patient reasonably expect as far as functional recovery after one of these procedures?
I love the word you said. Please say it louder. Functional recovery. Because I think that our goal, right, in the PT world, and I think sometimes it gets confused, is to regain as much function as possible. And I think that with some of the new technologies, we're seeing new levels of recovery from patients. And also their fitness levels are now coming in oftentimes slightly higher than I think they were before, because people are thinking about how important it is to be fit earlier in life, and that leads to better outcomes later in life. But our biggest thing, right, is to get back, getting them their ability to do everything that they want to do on a daily basis, those activities of daily living. And I think that sometimes some patients come in, I mean, the number of total knees that go out and say like, well, I want to get back to marathon running. And I'm like, okay, let's talk a little bit more about what we should be expecting after a massive knee replacement with an orthosis that's now put in there. Is slightly different, but it leads to very good conversations, and it's only leading to a propulsion of the technology that we're seeing the physicians use.
Yeah, we're certainly seeing things that sounded impossible even 10 years ago. Customized knee prostheses based on actual scans of your specific bones. We're seeing robotic assisted placements and guides to make sure that knee functions as closely to your actual knee as possible. And I think all this enhances our ability as physical therapists to maximize the functional recovery. If that prosthesis is going to be a smaller and smaller limiting factor in your end recovery, it allows us a bigger window and probably better potential to get a full recovery afterwards.
We're seeing some of these guys now. Again, it may take 6 months to a year for you to feel that you no longer have a false knee or a prosthetic put into you or a hip. But we're seeing, I've seen total hips who they come in 3 or 4 days after their total hip and they're walking. And I look at them and I'm like, well, did you actually have surgery? And it's not until I inspect their incision that I'm like, oh my God, this surgery outcome is fantastic. This only means that you're going to get so much better and so much stronger faster. Now, that doesn't mean we're necessarily going to do less PT. That just means the bar for us just gets set that much higher for what we can expect to come out.
I think there's an aspect to this too where we think about technology continuing to increase. That's also on the rehab side. So we have more and more tools at our disposal to maximize people's recovery. And also just to make sure that there's not as much hesitation on the part of the patient. So I think we've all had experiences where we've seen post-operative cases where they waited so long that our job gets a whole lot harder. Their status going in was tougher, they were more medically compromised, they didn't have the building blocks, they got weak, they got stiff. There should be a very focused educational piece to what we do to get people amenable to the idea of a joint replacement at this point. Certainly it's a big decision, certainly you need to weigh your options and talk with your physicians, but I think we can attest to the fact that there is a very, very good prognosis on the flip side of that. And so if people are hesitant but maybe are a great candidate, they should definitely explore that option with their physician.
Well, what Sami said about getting patients better sooner is important, I think, because a lot of patients avoid their surgeries because they say, well, I can't take 12 weeks off of work, or I can't, not pick up my kid for 6 weeks. And so, the sooner piece is really important. If we can get patients back to their prior level of function faster, that's a big factor to them.
But there's all these myths out there that I think we have to dispel, and that's a lot of the prehab process as well. Even in areas like this where we have access to the greater public, just before they've even made the decision to explore it, at least get out there and have an educational presence in the market. So let's go down the panel. We'll do some closing statements on prehab and rehab specific to joint replacement. Sami?
I think the biggest thing I could say is that, we've had a beautiful, wonderful foundation for prehab, right? The idea, the concept of getting you in early, getting you stronger, getting you fitter, so that way, the stronger, the better your range of motion going into surgery, the better you're going to be coming out of it. And so the concept of prehab is something that, we love and we use quite often and quite frequently, as often as we can. And our biggest thing now is seeing the horizon, getting with the technology, meeting with our physician cohort staff, and getting advanced. That way we can get our patients better, faster, and stronger.
I think having a holistic approach to the program, to go in, to be as best prepared as you can be going in is great. Having a relationship with the therapist and the patient is also a confidence builder and can really help with that. And I think that you need to remember that by the time patients go and have their joint replaced, they've usually been pretty miserable for a long time. And so it's not just one isolated thing. It's not just that you have this dysfunction because you had surgery last week. You've had this dysfunction probably for a year or two. And we have to help patients recognize that the recovery is quicker, it's better, it's faster, it's stronger. Patients have higher expectations, but they have to really work kind of in a holistic manner and try to overcome all the dysfunction and impairment that has happened as they have slowly deteriorated prior to the surgery.
I think the big thing here is that the research shows that patients do better when they have prehab and rehab. You get more education, you get more knowledge, and so then there's no surprises, at any point of the way. And I think that's really what patients need. They want to feel comfortable with what's going to happen now, and they want to feel comfortable with what's going to happen afterwards. And when they have a therapist to talk to and they can collaborate that with their physician, they feel like they know exactly what to expect, and that's really helpful.
Thank you all for your input. I love hearing from you all. I learned a lot. Hopefully you did too. If this is a topic that's near and dear to your heart, if you've got some joint pain, or if you know for a fact that you're a candidate for joint replacement, certainly reach out. We'd love to schedule a consultation with you to discuss some options, whether it's with one of our physical therapy staff members or with one of our surgeons. Thank you for tuning in to On the Go with CAO. Until next time, stay safe and be well.
We hope you enjoyed this episode of On the Go with CAO and invite you to tune in next time. To learn more about our upcoming episodes or to check out our online library of previously broadcast episodes, please visit cfaortho.com/hub. That's /HUB. Or search for On the Go with CAO on your favorite podcast app. Want to help keep others healthy and on the go? Then please share this episode. At CAO, you'll find over 160 orthopedic specialists committed to providing patients with an exceptional standard of care. The information contained in the On the Go with CAO podcast is for informational purposes only. It is neither intended as rendering medical advice nor as a substitute for seeking professional medical assistance. No relationship between the Centers for Advanced Orthopaedics and its practitioners may be created through On the Go with CAO. Any individual with specific questions regarding his or her individual health or treatment options should contact the Centers for Advanced Orthopaedics and schedule an appointment with one of its practitioners.